In order to provide holistic care, we need to incorporate, support, and explore the spiritual health of that individual. I feel empowered by being able to prescribe opioid agonist therapy, and I feel very trusted by not only my clients, but the BC government for allowing registered nurses to use our clinical judgment to provide this higher level of care.
Opioid use disorder is an addiction to opioids, and opioid agonist therapy works on the receptors to safely replace and support somebody from moving away from the toxic drug supply, but also treating their withdrawal and creating stabilization for them.
Hey, I'm Kyle. Why don't you come on back?
The initial public health order from 2016 was innovative at the time to launch a public health emergency around the opioid overdose crisis.
So what brings you in today?
The idea of nurses prescribing agents has been under consideration for quite some time before that. We knew that with appropriate education and training, registered nurses and registered psychiatric nurses have the ability to safely prescribe medications.
I think where we uniquely optimized nurses prescribing OAT is through outreach models in our rural and remote areas. So nurses, through their own passion and advocacy, have really stepped away and they integrate outreach in their community. They meet people where they're at. They partner with other nurses to go out into community and provide access to clients. So to me, that's an innovative and flexible way of providing OAT that we previously weren't able to do before.
It's been a really cool experience to be able to work alongside these nurses who are prescribing and being connected with the Regional Health Authority and just seeing the impact that nurses are making by being able to prescribe. It's really important to recognize that communities are the experts in this work. We see that they're able to heal on the land and they're able to get connected with culture and just feel loved and supported.
We've undertaken a pretty robust evaluation process, and the results are quite supportive and positive on the overall perception and safety and impact of this initiative.
This is the first time in Canada that registered nurses and registered psychiatric nurses can prescribe opioid agonist therapy, but this is also the very first time that registered psychiatric nurses are included in certified practice.
There you are. The impacts that I would like to see from this program moving forward is ultimately saving lives. Indigenous people are disproportionately represented in the overdoses that occur here in British Columbia. So if we can continue to break down barriers, to decrease stigma, it's going to lead to less overdoses and a healthier community overall.